What is bipolar disorder? Bipolar disorder, also known as manic-depressive illness, is a mental health condition that causes extreme mood swings, including episodes of depression and mania or hypomania. The word manic describes the times when someone with bipolar disorder feels overly excited and confident. These feelings can also involve irritability and impulsive or reckless decision-making. About half of people during mania can also have delusions, believing things that aren't true and that they can't be talked out of, or hallucinations, seeing or hearing things that aren't there. Hypomania describes milder symptoms of mania, in which someone does not have delusions or hallucinations, and their high symptoms do not interfere with their everyday life. During manic or hypomanic episodes, individuals may experience symptoms such as elevated mood, increased energy, racing thoughts, decreased need for sleep, impulsive or risky behavior, and grandiosity. During depressive episodes, individuals with bipolar disorder may experience symptoms such as sadness, hopelessness, low energy, loss of interest in activities, changes in appetite and sleep patterns, and thoughts of suicide. Depressive describes the times when the person feels very sad or depressed. Those symptoms are the same as those described in major depressive disorder or clinical depression, a condition in which someone never has manic or hypomanic episodes. Most people with bipolar disorder spend more time with depressive symptoms than manic or hypomanic symptoms. There are several types of bipolar disorder, including 1. Bipolar I disorder. This type of bipolar disorder is characterized by at least one manic or mixed episode, and often includes one or more depressive episodes as well. Manic episodes are defined as a period of elevated, expansive, or irritable mood lasting at least 1 week, accompanied by symptoms such as increased energy, reduced need for sleep, grandiosity, and impulsive behavior. A mixed episode involves symptoms of both mania and depression occurring simultaneously. 2. Bipolar II disorder. This type of bipolar disorder involves one or more major depressive episodes and at least one hypomanic episode, which is similar to a manic episode but less severe. Hypomanic episodes typically last at least 4 days and involve symptoms such as increased energy, elevated mood, and decreased need for sleep. 3. Cyclothymic disorder. This type of bipolar disorder involves numerous episodes of hypomania and depressive symptoms that are less severe than a major depressive episode. These episodes typically last for at least 2 years in adults and 1 year in children and adolescents. 4. Other specified and unspecified bipolar disorders. These are categories for bipolar disorders that do not fit the criteria for bipolar I, bipolar II, or cyclothymic disorder. Note that bipolar disorder is a complex condition and symptoms can vary widely between individuals. Accurate diagnosis and treatment are key to managing the condition effectively. The dramatic episodes of high and low moods do not follow a set pattern. Someone may feel the same mood state, depressed or manic, several times before switching to the opposite mood. These episodes can happen over a period of weeks, months, and sometimes even years. How severe it gets differs from person to person and can also change over time, becoming more or less severe. What are the symptoms of bipolar disorder? Bipolar disorder is characterized by 2 types of episodes, manic or hypomanic episodes, and depressive episodes. Manic or hypomanic episode symptoms. Elevated or irritable mood. Increased energy and activity levels. Reduced need for sleep. Racing thoughts or rapid speech. Grandiosity or inflated self-esteem. Risky or impulsive behavior. Poor judgment. Increased sexual drive. Distractibility, and agitation or restlessness. Depressive episode symptoms. Persistent feelings of sadness or hopelessness. Loss of interest or pleasure in activities once enjoyed. Changes in appetite or weight. Insomnia or hypersomnia. Fatigue or loss of energy. Feelings of worthlessness or guilt. Difficulty concentrating or making decisions, and thoughts of death or suicide. It's important to note that bipolar disorder can manifest differently in different individuals and the symptoms can be unpredictable. Additionally, some people may experience mixed episodes, which involve symptoms of both mania and depression occurring at the same time. What are bipolar disorder risk factors? Bipolar disorder is a complex condition that likely arises from a combination of genetic, biological, and environmental factors. Some potential risk factors that may contribute to the development of bipolar disorder include genetics. Bipolar disorder tends to run in families, and research suggests that there is a genetic component to the disorder. People with a parent or sibling who has bipolar disorder are more likely to develop the condition. Biological factors. Changes in the structure or function of the brain, as well as imbalances in neurotransmitters, such as serotonin, dopamine, and norepinephrine, may contribute to the development of bipolar disorder. Environmental factors. Trauma, stress, substance abuse, and other environmental factors may contribute to the development of bipolar disorder in people who are genetically predisposed to the condition. Substance abuse. Substance abuse, particularly with stimulants such as cocaine or amphetamines, can trigger a manic episode in people with bipolar disorder. Age and gender. Bipolar disorder can occur at any age, but it often develops in late adolescence or early adulthood. Women are more likely to experience rapid cycling and mixed episodes, while men are more likely to experience substance abuse and to have a family history of the disorder. Having one or more risk factors does not mean that a person will develop bipolar disorder. How is bipolar disorder diagnosed? Bipolar disorder is typically diagnosed by a mental health professional, such as a psychiatrist or psychologist. The diagnostic process usually involves several steps, including medical and psychiatric evaluation. The healthcare provider will conduct a thorough evaluation of the person's medical and psychiatric history to rule out other conditions that may mimic bipolar disorder, such as thyroid disorders, substance abuse, or anxiety disorders. Mood assessment. The healthcare provider will ask the person about their mood symptoms, including the frequency, duration, and severity of their manic or depressive episodes. Diagnostic criteria. The healthcare provider will refer to the Diagnostic and Statistical Manual of Mental Disorders or DSM-5 to determine if the person meets the diagnostic criteria for bipolar disorder. Physical exam. The healthcare provider may perform a physical exam or order blood tests to rule out other medical conditions that may be contributing to the person's mood symptoms. Psychological testing. In some cases, the healthcare provider may use psychological tests or assessments to help make a diagnosis or rule out other conditions. Accurate diagnosis of bipolar disorder can be challenging, as symptoms may be mistaken for other conditions, such as depression or anxiety. It's important to seek evaluation and treatment from a qualified healthcare professional if you or a loved one is experiencing symptoms of bipolar disorder. What are the treatments for bipolar disorder? The treatment of bipolar disorder typically involves a combination of medication, psychotherapy, and lifestyle changes. The goals of treatment are to stabilize mood, reduce symptoms, and improve overall quality of life. Here are some of the main treatment options. 1. Medications. Mood-stabilizing medications are typically the first-line treatment for bipolar disorder. These medications can help reduce symptoms of mania, hypomania, and depression. Common mood stabilizers include lithium, valproic acid, and lamotrigine. Other medications, such as antipsychotics and antidepressants, may also be used to treat specific symptoms. 2. Psychotherapy. Psychotherapy, such as cognitive behavioral therapy or CBT, or interpersonal therapy, can help people with bipolar disorder manage their symptoms and improve their coping skills. Family therapy can also be helpful in improving communication and reducing stress within the family. 3. Lifestyle changes. Making healthy lifestyle changes can also be helpful in managing symptoms of bipolar disorder. This can include getting regular exercise, eating a healthy diet, getting enough sleep, and avoiding drugs and alcohol. 4. Electroconvulsive therapy or ECT. In severe cases of bipolar disorder that are not responding to other treatments, electroconvulsive therapy may be recommended. ECT involves the use of electric currents to induce a controlled seizure in the brain, which can help alleviate symptoms. Treatment for bipolar disorder is individualized and may involve a trial-and-error approach to find the right combination of medications and therapies that work for each person. Accurate diagnosis and treatment are essential to manage the symptoms and improve quality of life for those with bipolar disorder. Ongoing monitoring and management are also important to ensure the best possible outcome.